In this video, the Center for Teaching at the University of Veterinary Medicine Hannover will demonstrate the placement of a cruciate stitch in the form of an interrupted suture. The focus of this video will be on the technique of the suture. As the name suggests, interrupted sutures are placed and fixated singularly. This has multiple advantages, such as a simpler placement and a more secure closure of the wound, since if a single stitch opens, the rest of the sutures remain intact. Furthermore, individual sutures can adapt better to irregular wound shapes. This technique does, however, come at a higher material and time cost, as well as causing a stronger tissue reaction. When placing interrupted sutures, it is essential to begin on the side of the suturing hand. The securing knot should also be positioned next to the wound gap. When placing interrupted cruciate sutures, the needle is driven through both cutis and subcutis, as can be seen here. The layer underneath these represents the fascia and muscles. Illustrated here is the path of the needle and suture material when placing interrupted cruciate sutures. The distance between wound and each suture is dependent on a multitude of factors and varies depending on the species, the individual patient, as well as the state of the tissue. Since the focus of this video is the general technique, these variables will not be considered. Interrupted cruciate sutures are used, for example, when closing the abdominal muscles, for tissue with a high level of mechanical strain, and for larger surgical wounds on large animals. This is due to the wide adaptation of the wound edge, the even tension distribution of the tissue, as well as the high range of flexibility, especially during movement. Needed for this skills lab exercise are a suture pad, a needle with attached suture thread, gloves, a pair of anatomical forceps, a needle holder, a pair of surgical scissors, as well as a pair of ligature scissors. The required needle is an atraumatic suture needle without an eyelet. Instead, the thread is connected to the needle directly. This creates a smooth perforation of the skin during suturing, which is gentler on the surrounding tissue. Therefore, an atraumatic suture needle is better suited for fine, delicate tissue such as internal organs, blood vessels, or skin. Traumatic suture needles come separate from the thread, meaning that the suture material must first be threaded through the needle's eyelet. Due to the wider eyelet and the folded thread, a larger trauma of the tissue is created. Traumatic suture needles should only be used on more robust tissue such as muscle or fascia. Procedure. The needle holder and suture needle are held in the dominant hand, with the suture thread collected in the palm. The stitch begins on the side closest to the suturing hand. A right-handed suture will be demonstrated. In the first step, the wound gap is lifted with the forceps. This allows a view onto each of the tissue layers, which are depicted as follows. Beginning at the top is the cutis, then the subcutis in red, as well as the fascia and muscles, represented in white. The needle is driven perpendicular and with minimal distance to the wound gap. The needle is held with the forceps, allowing the needle holder to grasp the middle to lower third of the needle. In the next step, the opposing edge of the wound is lifted with the forceps and the needle is driven from the inside out. The needle can then once again be grasped with the forceps, placed back into the needle holder, and the suture material is pulled through. The needle should be placed in the same position as will be required for the next step. It is vital that the needle tip is never held, as this can quickly lead to blunting. The suture material should also only be pulled on with fingers. After this, the needle is driven through, perpendicular to the wound once more, however, next to the initial placement. The cruciate suture can be fixed with a surgical knot. Finally, the suture ends can be shortened to 1 scissors blade width. After the wound is adequately healed, the skin sutures can be removed with a pair of ligature scissors. For repetition, the placement of a further interrupted cruciate suture will be demonstrated.